Good day, everyone. I am Linal Hope Casilaw, and I will be presenting to you Locsin's technological competency as caring in nursing. To start, let's get to know Dr. Rosano Locsin first. Dr. Rosano Locsin was born on March 25, 1954. As of the moment, he is 66 years old. He is a registered nurse and a native of Dumaguete City, Philippines. Currently, he resides in Tokushima University, Tokushima, Japan as a professor of nursing. He gained his Bachelor of Science in Nursing in 1976 and Masters of Art in Nursing in 1978, both in Silliman University of the Philippines. In 1988, he achieved his Doctor of Philosophy in Nursing in the University of the Philippines. In 1991, he became a professor of Christine Allen College of Nursing, Florida Atlantic University. His program of research is Life Transitions in the Health Illness Experience. His awards includes Fulbright Scholar to Uganda in year 2000, Fulbright Alumni Initiative Award to Uganda in 2004 to 2006, Fulbright Senior Specialist in Global and Public Health and International Development, Edith Moore Copeland Excellence in Creativity Award, Sigma Theta International, and Lifetime Achievement Awards from Schools of Nursing in the Philippines. His book publications includes Advancing Technology, Caring and Nursing in 2001, Technological Caring and Nursing, a Model for Practice in 2005, and A Contemporary Process of Knowing, The Unbearable Way of Knowing in Nursing in 2009. Dr. Rosano Locsin's assumptions in nursing are: persons are whole or complete in the moment. Knowing person is a process of nursing that allows for continuous appreciation of person moment to moment. Nursing is a discipline and a professional practice. Technology is used to know persons fully in the moment. Locsin's technological competency as caring in nursing. Technological competency as caring in nursing is the harmonious coexistence between technologies and caring in nursing. This means that technologies are important accessory for the nurse to render a competent nursing care. The harmonization of these concepts places the practice of nursing within the context of modern healthcare and acknowledges that these concepts coexist. Technology brings the patient closer to the nurse. Conversely, technology can also increase the gap between the nurse and the nurse. This happens when technology substitutes what nurses could offer. When technology is used to know persons continuously in the moment, the process of nursing is lived. Locsin's knowing the other person. Technological competence assists the nurse in acknowledging the person as a focus of nursing, using technology competently to complement or assist the nurse in knowing the patient in the moment. Caring in nursing. Authentically knowing the person in the moment to the extent to which they wish to be known. The patient only let the nurse know what they want them to know. Human beings as person. Knowing the person in the moment as a whole and complete persons despite their condition. Dimensions of technological value in the theory. Technology as completing human beings to reformulate the ideal human being, such as in replacement of parts, both mechanical, in the form of prosthesis, which is the artificial device that replaces a missing body part, or organic, in the form of transplantation of organs, or the transfer of organs from one person to another. Technology as machine technologies. Computers and gadgets enhancing nursing activities to provide quality patient care. Technologies that mimic human beings and human activities to meet the demands of nursing care practices, such as cyborgs or the cybernetic organisms, which are being that is partly human and partly machine, or anthropomorphic machines, or the attribution of human traits, emotions, or intentions to non-human entities and robots such as nurse bot. Risk with technology in nursing. Dr. Google. Patients diagnosing or misdiagnosing themselves based on information from the internet. This happens when patient chooses to self-medicate rather than seek help from healthcare professionals. Confidentiality, the widespread of availability of private information. This happens when confidential data are being hacked. Technological competency as caring in nursing, four-phase nursing process. First is knowing. It involves understanding the patient as participants rather than objects of their care, and the patient will let the nurse know what they want them to know. Technology is used to magnify the aspect of the person that requires revealing a representation of the real person. The person's state is dynamic living and cannot be predicted. This means that person's state changes moment to moment. Next is designing. Both the nurse and the one nursed or the patient plan a mutual care process from which the nurse can organize a rewarding nursing practice that is responsive to the patient's desire for care. It includes a mutual coordination between the nurse and the patient. Participation in appreciation. The simultaneous process co-joined activities which are crucial to knowing the persons. In this stage of the process is the alternating rhythm of implementation and evaluation. The evidence of continuous knowing, implementation, and participation is reflective to the cyclical process of knowing persons. Lastly, the verifying knowledge. The continuous circular process demonstrates the ever-changing, dynamic nature of knowing in nursing. Knowledge about the person that is derived from knowing, designing, and implementing further informs the nurse and the one nursed. Meta-paradigm in nursing. Nursing, described as a discipline and a specialized practice that uses technologies to individualize care to meet the unique needs of person. Person, the recipient of nursing care, has desires, dreams, and ambitions are to live completely as caring persons. They also want to feel acknowledged as a unique person with hopes and dreams and not as an object. Health, having the patient participate in their own health and in using technologies to better understand the hemodynamics or the basic measures of cardiovascular function of the patient to provide the best care and meet their individual needs. Environment, the surroundings that use technology such as a critical care unit to understand the person as a complete moment by moment. Increased technological monitoring allows for greater insight as a whole state of health. Nurses must be efficient and proficient with technologies without losing focus on the person as a whole. Knowing persons framework for nursing. The nursing as caring, knowing persons, multiple patterns of knowing in nursing is a cyclical process, and the calls for nursing must be responded by the nurse. The calls for nursing include supporting, affirming, and celebrating, while the multiple patterns of knowing in nursing includes empirics, aesthetics, ethics, and personal. The calls for nursing. Nurses rely on the person for calls. Knowing the persons allow the nurse to use technologies in articulating calls, illustrations of the person's unique hopes, dreams, and aspirations. Individual expressions such as desire to go home and wishing to die peacefully. Nursing responses. Nursing responds to calls from persons. Nurses respond with authentic attentions to fully know the persons continually in the moment. Nursing as caring, to direct, focus, sustain, and maintain the person through calls and responses for nursing. Knowing persons includes knowing who is person and what is person. Who is person? Understanding the unpredictable, irreducible person who is more and different than the sum of his or her empirical self. Persons as unique individuals. What is person? Empirical facts about the compositions of the person. Persons as objects. Multiple patterns of knowing in nursing. This includes empirical knowing or the factual and aligned with qualitative explanations. Ethical knowing draws one's moral values. Personal knowing relates to understanding and actualization of relationship between nurse and patient. Aesthetic knowing respects the patient and the patient's need. Locsin's theory acceptance by nursing community. In nursing practice, broad concepts of caring and technologies have been applied to nursing in the critical care setting. In education, technology is used to know persons fully in the moment. In research, technology competency in nursing fosters the recognition and realization of persons as participants in their care rather than as objects of care. The analysis and evaluation. Simplicity. Locsin's theory is simple in that it focuses on the relationships of a few concepts. Generality. Have no specific order to allow the Locsin's framework or mode, such as using the device procedure. Empirical precision. The scope of Locsin's theory is narrow, using technology, caring, and knowing persons. Derivable consequences. Locsin presented a foundational viewpoint of technological competency as caring in nursing. That would be all. Thank you.